finally got my introduction straight. And I ain't recorded none of it. None of it. Hello, friends, and welcome to... That sounds like I should be starting somebody's church. Friends, family, visiting church. Hey, y'all, and why am I... Why is that a thing? Stop. Like you ain't never recorded a video before. What is your problem? Hey, y'all, and welcome back to Oh, That's Nisha. I'm still Nisha, and dang, what was I about to say? Hey, y'all. If you are new here, welcome to Oh, That's Nisha. If you're a returning subscriber, then thanks. Like, you really came back. I'm just playing. Everybody should come back because this is a great channel. All right. First, before we get started with the video, I need backdrop ideas. Like, that's a very weird thing to ask for, but like, I like this little setup, but this is a couch. It can't go with me to all of my different assignments. So if you have any backdrop ideas, theme ideas, Amazon links, you know, drop them in the comment. Where the comments go? Drop them below. So as you can see from the title, this video is about the pros and cons of travel nursing. This is obviously very subjective. It depends on what you like and what you don't like. But I am going to give you some of my opinions and some opinions of people who've told me why they would or would not travel. I'm just going to kind of throw them all in there. That's really it. Let's get into it. So first, we're going to start with the cons. Con number 1, you are away from your family and friends for an extended amount of time. I think that's probably a con that everybody can like agree on. It can be hard, but it's kind of part of the job description because you travel. So yeah. Con number 2, one that some people might not really think about until you start traveling, is the hospital policies. Are the hospital policies? Whatever. Hospital policies change from hospital to hospital. Like, they are specific to that unit, that hospital at that time, honestly. That can be a con because you have to make it a point to know that policy. Like, that's kind of on you because you have to do things according to the policy at that place. And if you're constantly traveling, obviously the policies are constantly changing, you know? So that's con number 2. Con number 3, and this has to be like my least favorite one, is scheduling. So depending on where you're working, you might be able to make your own schedule, or the manager of the unit might make your schedule. You might like to put all of your work days together, or you might like to separate them, but then you might get a schedule that's the complete opposite of what you would normally do for yourself. However, you're there to fill a need, and depending on the hospital and the manager and their needs, you might not have a choice. Like, that just might be what you get. And that could be annoying, you know? Con number 4 is floating. This isn't really one I've had like a lot of problems with, but I have heard of a lot of other people who work in other like different types of units having this problem. On labor and delivery, I feel like most of them I've gone to has been so busy that we really don't float. And if we do, it's like antenatal or antepartum, whatever you want to call it. Every now and again. But as a travel nurse, you will probably be the first to float. That's just, again, part of being a travel nurse. Sometimes you can get lucky and be at a hospital where they put you in the rotation, so you might start the rotation or whatever when you get there, but then it's whoever's next in line. Or you could not be as lucky, and here's the con part, and just float whenever they need somebody to float, and it's gonna always be you, the travel nurse, you know? Just depends. Now, these next couple of cons really aren't necessarily cons to me, and they might not be cons to you. They can be cons depending on the situation. So we're just going to call them I don't know what else you want to call it. We're going to call them Okay, number 1 is that there are different ways of doing things. Sometimes there isn't like a right or a wrong way, but when you go to different places, they might want you to do things their way. Some people don't like doing things new ways. Me personally, when it comes to most stuff, I like learning the new ways of doing stuff because some stuff I've never seen, some stuff I've never used for these situations. So I like learning the new way of doing things, but some people do not like that because they like doing the way that they know works or that they've always used. But if you're at a new facility, then you do it the way they do it, unless obviously it's a patient safety issue, risking your license, whatever, you know, unless it's like that, you just do it how they do it, if you have to, you know. And to me, that's not a problem, but to some people that can be a con because they don't want to do that. And number 2 is new people. So yes, you meet a lot of new people, obviously, because you're working with new people. And to some people, that can be a con because they don't like working with new people because they depend on, not depend in like a negative way, but they like knowing they have somebody there to support them on their unit. And new people at new places aren't always going to be that person. Like they just might not be, whatever. But some people don't mind meeting new people because they like meeting new people. And they don't care whether or not the people on this unit, I guess, kind of have their back because they know what they're doing. Don't get me wrong. On a unit, you should work together and teamwork and yada, yada, yada. But it's a different, like, I feel like any nurses can agree that it's a different level of trust you have with people that you worked with for long periods of time. Like, you trust them with your patients. You trust to go to the bathroom and they watch your strip. Like, you trust people on different levels, and when you go to new places, you don't just automatically, you know, get that trust. So that can be a con, could be a pro, because you also have to, you can't really depend on this unit of people that you don't know. You have to be confident in your own skills. So it really just depends on how you lean in that way. So now to the good part, okay? Now to the pros. The pros are not debatable. Period. I'm just playing. They could still be debatable. I'm just playing. So pro number 1 is probably the one that everybody, when they talk to me or meet me or try to talk to me and slide in my DMs, the first thing they want to mention is the money. I didn't mean to look so disgusted, but I do be. So like, if you're watching this and you just slid in my DMs and you're like, oh, you make nurse money, please don't. That's off topic, but just giving you this tidbit of information. Please stop. All right, back to pro number 1, the money. You are paid a decent amount of money. I say decent, but it's decent because you are expected to be paying for 2 different living accommodations. So you're paying for your house in your home city, and you're also paying for wherever you're staying, where you're traveling. So that's why it's so much money, because you're paying for 2 living expenses, 2 sets of living expenses. You know what I mean? Does that make sense? If it doesn't, just like comment below so I can like kind of make it make more sense. I hope it makes sense. So yes, you make more money, but you also have to, again, factor in the cons. And one of those might be that you make more money because you're having to pay for my house back home as well as my house where I'm staying right now. You know, like you're doubling your expenses. So why wouldn't you make more? Like, what would be the, you know? What's that? We're gonna just keep pro number 2 is the freedom. This is probably my biggest pro ever. Like, yes, the money is nice. Of course, we need money to do stuff, whatever. But the freedom of not having to work somewhere that you don't want to be, because after 3 months, you can extend if you want, or you can leave and never look back, never go there ever again. Being able to take a vacation and not having to ask anybody like, oh, can I have off these days? Once my 3 months are up, I can just not take another contract and take a vacation for as long as I want. Like, you know, freedom. It just feels so much freer to be able to choose where you work and to be able to change that when you don't like it and not feel like stuck. Because well, that's another video idea. I'll tell you why I started travel nursing in a different video. But to just not have to feel stuck, like that sense of freedom is probably my biggest, like my favorite pro of travel nursing. Pro number 3 is, I guess, pretty obvious. You get to travel. So you get to not only travel in like, oh, this is a vacation sense of the way, but you get to like pretty much become a citizen of a different city whenever you feel like it. Like for like 3 months, and get to explore that city and see all the stuff instead of for like a weekend, you know? Yeah, that one I feel like is kind of obvious, but it's still a pro in my opinion. So yeah, those are the pros, cons, and in-betweens of travel nursing in my opinion. If you have any that I didn't list that you would like to list, or that you think I listed as a pro and will be a con to you, or I listed as a con will be a pro to you, tell me in the comments below. Let's talk about it. So yeah, that's it for this video. Be sure to like, comment below, subscribe, and turn on your notifications so you can know when my next video is. I'm out, y'all.